Brown's bill would charge rape victims with a felony for having abortions, charging them with tampering with evidence. You've been listening to WIN, Workers Independent News.
Economy.us that talked about how it's legal for corporations to steal from these pensions.
If you put it's our economy.us and search Peabody, you can find this article about how they essentially destroyed their employees' pensions in this one firm.
Right, and as we talked about in a previous show about the tar sands blockade going national, there was an excellent protest over the weekend in
Yes, there was.
In Portland, Maine. Groups came together to protest the tar sands.
It coincided with the Northeast Regional Gathering of Occupy.
That's right.
And a lot of organizations were involved in this, and they had over 1,000 people out protesting in freezing cold weather.
That's right. And Dr. Jill Stein was there, one of our favorites as a speaker. Also wanted to share with our listeners our recent article in Truth Out, based on our show with John Curl.
It's gotten a great response. You go to truthout.org. I think it's you can find it just by putting in either my name, Zeese, or Margaret's name, Flowers, and you'll come up with it. It's about the history of cooperative movements and community working together to solve economic problems. And it's an amazing history that is hidden from us. So if you want to know the truth about our long history of people working together, not this media-created free market image of the lone cowboy making it on his own and screw everybody else, I'm just going to get rich. People actually have, going back to before the country was colonized by Europeans and continuing during the European colonization, there has been a long history of people working together in communities to solve problems and forming co-ops and communes, and it's an amazing history, and it ties in
with social change.
With social change. If you look at the American Revolution, which was, the Tea Party was against the monopoly of a corporation, the British East India Company.
Right.
And if you go through abolition, women's rights, union rights, worker rights, farmer rights, all the way through history, you see how it intermingles with this idea of community working together.
Yeah, yeah. So, of course, the hot topic these days is the deficit, right?
They're always talking deficit. That's
right.
We hear it on the media all the time. We hear it in the think tanks and the politicians.
This is what we're hearing, that entitlement spending will nearly double by 2050. Tax revenues are being devoured by Medicare, Medicaid, and Social Security. Medicare is adding to the federal deficit. This all really sounds really bad, doesn't it? It
does sound bad. It's and that's what you only hear about, and we're going to turn that on its head today.
That's right.
And try to get some stuff into the public dialogue that has been excluded, facts that people don't talk about.
Because this is such, what I'm reading, the current news, it's such completely the opposite from what people want and what will work, but the real solutions are not being talked about in the corporate media.
Well, not only are the real solutions being talked about, the real problems are not being talked about. A lot of people think that our elderly, our retired folks are doing fine.
Oh my goodness!
And the reality is quite the opposite. I mean, for example, according to the census, 78% in Americans over 60 facing the threat of hunger.
Wow.
The Census Bureau reports that 1 out of 6 Americans over 60 are living in poverty. Now, you don't hear that mentioned when they talk about cutting Social Security. There were already 1 in 6. In fact, if you look at the figures, there are tens of millions who would be in poverty if Social Security gets cut in any way at all. I mean, the 3% cut that there seems to be bipartisan agreement for in Washington, D.C., will result in people living in poverty.
Right, more people living in poverty.
More elderly living in poverty. Now, we've already covered in other shows the problems of youth and student debt, so there's problems in that end too. But today we're going to focus in large part on the elderly, and both on health care and on retirement. The other thing that's not talked about, they always say the demographics have changed. We have to, Social Security wasn't set up for this kind of people this long, living this long, and we have to change Social Security to deal with the demographics. Well, the key demographics that have changed that are not talked about, and we'll get into this more with Stephen Hill,
one of our guests,
who will be our first guest, and he's written some great stuff on Social Security, and he's calling for a doubling of Social Security benefits rather than cuts to them.
Right, total opposite from what you're hearing.
We're turning it on its head, as we said. We're going to turn this on its head and talk about real solutions. What the real demographics that have changed has been the disappearance of pensions. You know, you used to be, people like to always talk about a three-legged stool of retirement: Social Security, pensions, and savings.
Right.
Well, those two other legs, pensions, as we mentioned, some companies are trying to destroy the pensions.
Right.
Pensions that do exist are underfunded, especially state pensions, and so there's a real pension problem.
Right.
They're disappearing.
Right.
And more people are invested instead of pensions. They've switched people to this privatized, 401k,
Right.
which hasn't worked.
Right, and we should mention that, like in the case of Hostess Twinkies,
Yeah, that's a good example.
the pensions disappeared because the CEOs of that corporation looted it to pay themselves millions of dollars.
The hedge funders who came in and took the company over, Romney type hedge funders that come in and take the company over. They looted the corporation, paid themselves exorbitant bonuses, and destroyed the pension.
Yeah.
And so
it's not like pensions are just disappearing; they're being stolen.
They're being stolen, exactly.
Yeah.
And so pensions are being stolen. The 401ks rely on the stock market, which is not very reliable, and so that's a big problem. And savings are being destroyed.
38% of American families don't have enough money to save any of it.
Well, that's right. The reality is 1 out of 3 American working families can't make ends meet, so they can't save.
Right.
But the other thing is that a lot of people's savings is basically put into the house.
Yeah, and then what happens when
the housing bubble bursts?
Yep.
You lose all that equity. You lose all those savings, and so you're stuck in a situation where you don't have savings. And so what we are really seeing, it's not, so we hear all this talk about Social Security and the deficit. We don't hear talk about we need to rethink our retirement.
Right.
That retirement, the old New Deal retirement system of Social Security being part of a three-legged stool, now Social Security, 80% of retired folks, Social Security is their primary source of income.
And it's a poverty.
And it's you're talking about an average of $12,000 a year in incomes, $1,000 a month.
And if you look at healthcare costs as a proportion of that, our elderly that are living at levels below 200% of the federal poverty level, they're using up to a quarter of their income to pay their out-of-pocket medical costs. So
no, in fact, some research that came out in the last week looked at credit card debt.
Oh, that's another very serious problem.
And for the first time, one thing that's switched in recent years has been the elderly now have more debt than youth do.
Yeah, and a lot of that.
The average elderly credit card balance is $8,000, and half of Americans over 50 carry medical expenses on their credit cards.
Yeah.
Prescription drugs and dental expenses are the main contributors to that because we don't really cover that well. So the interrelationship between medical costs and debt and poverty for elderly is something that's really important, and we'll be looking at that with our two guests today.
Yeah, so that's something we really want to get into. And you and I testified before the National Commission for Fiscal Responsibility and Reform. That was Obama's first commission. It was created by him, and he appointed Simpson and Bowles to run that commission.
Funded by Pete Peterson.
Pete Peterson Foundation, which has been for decades trying to
cut Social Security, cut Medicare, cut social insurances.
Right.
They were the funders.
We argued before that commission that actually a solution like Medicare for All would not only solve our deficit crisis, but it would solve our healthcare crisis. It's the complete opposite of what you're hearing right now. This stuff in the corporate media about Medicare eating up our federal dollars and causing this huge crisis in a couple of decades where it'll be gone is completely false, because if we went to a real solution and improved Medicare for All, we could control our healthcare costs and we could help provide healthcare to everyone.
Well, it's not totally false. I mean, the fact is that healthcare costs keep going up, and Medicare is stuck inside a system that's dominated by market and insurance, and for-profit hospitals and for-profit insurance are pushing the cost of healthcare up, and Medicare pays the price for that.
Right.
They're a victim of the current system.
Exactly. Yeah.
And so the real problem is the system.
Right.
Medicare, on the other hand, if you look at Medicare, it is a very efficient.
Costs are rising more slowly than the private.
Costs are rising more slowly. Low administrative costs.
Very low.
There's no one making profit from it.
Right.
It's a totally different ballgame.
Except the private insurances that have now inserted themselves in our Medicare system, they need to be taken out completely.
So we'll be talking with a really good guest on that, Andy Coates, who we know well. He's the president of the Physicians for National Health Program,
right?
And he just started as president. He's a doctor who has a lot to say about the need for single payer.
Yeah, I mean, when I say that these conversations are false about Social Security and Medicare, is that they leave out very important and popular solutions that would be alternatives to the current situation. Yeah, if we keep Social Security exactly as it is right now, it will run out. But simple things like lifting the cap or taxing income on investments would completely make Social Security solvent for a long time to come.
And Stephen Hill has some very specific ways that he can fund this idea of doubling that's an exciting idea. The benefits, and think of the impact it has on
Can you imagine if
the economy,
seniors, and if seniors didn't have that burden of
facing poverty every day?
Yeah.
And if you add $1,000 more to seniors' income, that doubles it, $1,000 a month more. That $1,000 will get spent.
Right.
And so the economic impact is significant.
They're not going to hoard it.
It's the best. It's a real solid way to stimulate the economy, solve poverty, and relieve this burden. How much better families will feel, knowing that their parents are not suffering and being forced to pick low-grade ground meat versus decent food. Right. It's real. We have to take a break. And
I'm excited to get into this show and talk about these real solutions and turn this discussion on its head. But we're going to go into this break with a great song.
Yes. One of our favorites.
Steal Like a Billionaire.
Steal Like a Billionaire.
So appropriate.
All righty. Let's go with Steal Like a Billionaire.
You're listening to Clearing the Fog, Speaking Truth to Expose the Forces of Greed with Margaret Flowers.
And Kevin Zeese.
And we're going to bring in our first guest today. His name is Stephen Hill. He's a political writer and author of several books, including Europe's Promise, Why the European Way is the Best Hope for an Insecure Age. And you can find that at europespromise.org. He also wrote 10 Steps to Repair American Democracy, 2012 Election Edition. And that's at 10steps10steps.net. His articles and interviews have appeared in media around the world, and his personal website is stephen.hill.com. Good morning, Stephen.
Stephen, are you there? Good morning, Stephen.
Good morning.
All right,
great.
Good.
We've got you.
Good to hear you.
Thank you for taking the time to join us. We know that it's early where you are, so we appreciate you getting up.
The West Coast time. Yeah. We saw an article you wrote back in the end of December called "Don't Cut Social Security, Double It." And we both loved it when we saw it. We published it on our economic website, itsoureconomy.us, and we'll put a link up to it on the Clearing the Fog radio site as well. But your point there was a really solid one, and I loved it. What I loved about it was it came out in the midst of all this talk about austerity, and it was totally inconsistent with what people were hearing. Let's start out by first describing the reality of U.S. retirement today. How has it changed from the New Deal era, and what are our seniors facing today?
Sure, it's actually a fairly bleak situation that you wouldn't catch from listening to the discussions around Social Security, and it's simply the following: in the post-World War II era, the American retirement system has depended on what we call the three-legged stool of retirement, and those three legs are first private pensions. Second, private savings, which for most people was in the form of home ownership, and thirdly was your Social Security. Each of those three legs were roughly equal in length, and that's what led to the stable retirement stool. So we look at each of those legs now and what's happened to them. Private pensions used to be, in the United States, about 60% of private sector workers were covered by a private pension. That number is now down to about 10%, and it has increased
60%.
Great recession.
So 60% in 1981, and now it's down to 10% of private sector workers have a pension.
And then for public pension employees, they're still most of them are still covered by a pension, but the number of public employees has declined. We now have about 1 million fewer public employees today than we had in the Reagan era. To clarify what a pension is, it's a guaranteed payout. It's not like an IRA or a 401k where you're putting money in and then you hope the stock market does well and you get that as part of your retirement. With a pension, you've been putting into it all your working life, and then as a result, for every month that you're alive after you retire, you get a certain amount of money, and that doesn't change. Sometimes it can actually increase a little bit with some of the pensions have a cost of living adjustment.
So it's like receiving a paycheck every month.
Exactly. It's a very good way to provide for secure retirements for elderly Americans, and that leg has been hacked back to a nub, basically. The second leg is home ownership, and we know what happened to that in the middle of this economic recession. The housing bubble burst, and many people who had their homes lost them. Others now are still, there's about 25% of Americans whose homes are what's called underwater. The home is worth less than the mortgage. So basically, if they don't have any other types of savings, they are flat broke. And then many other Americans, that their home is still worth far less than it used to be. So the amount of money they thought they had for their retirement, they don't have anymore. So the second leg also chopped off. The third leg, Social Security.
Well, before we go to the third leg, let me ask you a little more. Now, the pensions were replaced by IRAs. Essentially, what that was the privatization of retirement away from a guaranteed pension plan to investing in the stock market. There's been an increase in that. Now, why doesn't that solve the problem?
Well, it doesn't solve the problem because the stock market is so unstable. And how many people they thought they had a certain amount in their savings plan, their retirement plan, because the stock market had gone to a certain level, and then it completely collapsed. So it's just turned out to not be a very stable way to depend for very much on your retirement plan.
So hint to all Americans,
right.
Privatization of pensions didn't work. Privatization of Social Security will do the same thing.
Right, but I just wanted to point out, because the recent Business Roundtable recommendations in the Medicare Modernization Act are calling for more incentives to get people to invest in these 401ks. And I think when I read that they're probably just trying to get more money for more people that have money to encourage them to invest that money in stocks.
It's also a problem because, not that many people are financially literate enough
That's right.
To know how to deal with the stock market.
That's
right.
Look, even professionals clearly don't know how to always make money on the stock market.
That's
and in
right.
fact, a study by the National Bureau of Economic Research found that more than 1/4 of baby boomer households thought hardly at all about retirement, and their financial literacy was, quote, alarmingly low. Half could not do a simple math calculation, divide $2 million by 5, and fewer than 20% could calculate compound interest. And it's just a study's way of saying that most people, to say to people your retirement is going to depend to some degree on your ability to navigate the stock market is just frankly ridiculous.
Well, then throw on top of that, Stephen, the reality of people's economics. I mean, 1 out of 3 working Americans barely can make ends meet each month, as far as are on the brink of the poverty increases among working Americans. So most Americans can't save, even if they knew how to save well and knew how to handle the stock market. They don't have the resources to do it. That's not going to happen. So now you want
right now, anyone who has any savings at all, of course. Do you put it in the stock market? Well, yeah, maybe if you're willing to tolerate some risk, because it's clearly risky, as we now realize. Or do you just put it in the bank where the interest rates are 0.00000 nothing?
Right.
Yeah. So it's
so
really
this is the choice, and you have to realize that the American retirement system, to some degree, was founded on one of these legs was founded on the idea that if you put your money away, you save it through interest and all these other wonderful mechanisms, you are going to have a nice nest egg at the end. And that's the part of the American dream that clearly didn't work out, and no one really is talking about it or has really a good idea of how to restore that nest egg idea built on compound interest and putting your money into CDs and all these sorts of things, because there's no money to be made out there by getting interest anymore on anything.
Exactly.
Wow. Yeah.
So now we have just a few minutes for a break, but I want to start a little bit of discussion of what Stephen's recommending.
Okay.
So, Steve, what we have about 2 minutes. So, what do you recommend, and we'll get into how to pay for it and all that kind of.
Talk about Social Security.
Go ahead.
Yeah, I mean.
Let's talk about Social Security. How's it doing?
Well, Social Security is doing fine for the most part. I mean, people talk about that it's not funded well, but it's funded pretty well through 2037, which is as good as any other government program. In the meantime, it's been a very stable and very popular part of our retirement program. The problem with Social Security is that it's become, for many, many people, and more people, a de facto national retirement plan. It is the one leg that they still have on this three-legged retirement stool, and so it's a very odd piece of furniture because a one-legged stool doesn't stand very well. And the problem is that it only pays about 33 to 40% of your final salary, compared to many other countries around the world where you're going to get twice that amount in your national retirement, national pension.
That's right. In Germany and France, you write about how they get 70% of their pre-retirement income from their public Social Security, while we get 33 to 40%.
That's just not enough money.
It's not enough money.
You have that be your major source of income when you retire.
It's about people typically get about $1,000 a month. $12,000 a year or so for their retirement, and that's why you're seeing increases in poverty that are significant among people in the elderly age brackets.
Yeah,
and it's just beginning. We're only beginning to see the impacts of this, and yet we're not really grappling with it. Most people just haven't saved enough money to deal with this situation in which their home ownership and the loss of pensions and what have you are no longer going to be part of that stool of retirement. So it's down to Social Security for many Americans. I have some statistics in the article about how many Americans are actually depending on this, and it's most Americans.
It's like 80% of Americans depend on Social Security as their primary source of retirement funds. So you recommend doubling the payout. So people go from $1,000 a month to $2,000 a month, and you talk about how to pay for that, what the impact of that would be on the economy, and we're going to talk about that in the next segment.
Right, but first we have to take a short break if you'll stay with us, and we're going into this break with a parody. It's called A Funny Social Security Song by Judy Aaron and Charlie Watkins.
Uh-huh.
And I said every bit.
Uh-huh.
On time. My Social Security. You're listening to Clearing the Fog, speaking truth to expose the forces of greed with Margaret Flowers.
And Kevin Zeese.
And our guest right now is Stephen Hill. We're talking about Social Security, and we found that song and thought it was pretty cute. I mean, it says, Uncle Sam kept that money safe and actually gets your check to you on time. And
but it's only $989.
That's right, and that's the problem. And that's why in this time of talking about cuts to Social Security, Stephen, you're on the complete opposite of that. You're saying no, double it. Tell us more about that.
Yes, well, I mean, one couple of quick numbers I think is important because most people, Americans, I think, don't realize the situation. Mm-hmm. Experts are telling us that when you retire, you're going to need to have about 70 to 80% of your pre-retirement income level, as well as about $200,000 in personal savings, to not see a drop in your standard of living. And yet a 2010 study found that 75% of Americans nearing retirement age had less than $30,000 in their retirement account. So that's the situation. And so I looked at that and I said, well, clearly we need to double the Social Security payout, not cut it. And this is the only leg of the stool we have left. And if you cut the only leg, you're going to have a much shorter stool. So I looked at the current ways that we fund Social Security, as well as some of the other deductions that we have that go to mostly to wealthy people, and started putting together the amount of money that we would need. To double the Social Security payout, we would need about $650 billion annually.
Okay.
That covers about 55 million Americans.
That's right. And so, first place we'd get it is, currently the way Social Security works is, people only pay taxes on Social Security up to the first about $110,000 of their income, and after that, you don't pay any more towards Social Security on any more of your income. So if you're making $1 million a year, you're only paying taxes on about $100,000 of that $1 million into the Social Security fund, and that's quite unusual for how we tax Americans for most other programs. Medicare, you pay taxes on all of your income. Same with income tax. But the Social Security, we have this payroll cap, and so if we just simply lifted that payroll cap so that everyone is paying the same percentage of taxes on Social Security, because if you're that average person, your Social Security is you're paying about 12.4%. That's split between you and your employer. But if you're $1 million banker, you're paying about 1% of your income.
So it's the most regressive. Social Security tax is the most regressive tax we have.
Exactly.
As far as any kind of income-related tax goes, putting aside sales taxes at the state level, but so it's a regressive tax.
It very much is. So if we just simply made it, an issue of equity, everyone paying the same rate of tax on all of their income, then we would raise about $377 billion towards the $650 billion we need to double the Social Security.
Great.
Yeah, and as a candidate in 2008, Barack Obama said that he would support raising the cap on this Social Security tax, which he has supported. They have lifted it from about $106,000 to $110,000, but it's just, it should be lifted entirely.
It does go up a little bit, just based on inflation. There's an automatic adjustment in that tax. So it goes up a little bit all the time. And what's interesting about that tax now, though, it used to be that 90% of income was covered. Now it's down in the 80s. So even just raising the tax up to that higher level, you'll do better. But anyway,
exactly. So that should be a fairly simple, straightforward way to raise most of the money we would need to double Social Security payout. The second way is in some ways is even easier politically, because many employers, if they provide a pension to their employees, they receive a substantial federal deduction for providing that employee retirement plan. If we're doubling the Social Security payout, then they don't really need to have the employees providing pensions anymore, because we would have a more robust national retirement system. So we could get rid of those deductions. Those deductions total a substantial $126 billion annually. You add that to the previous $377 billion, and at that point we are 3/4 of the way towards doubling the Social Security payout.
But that means that you see no further pensions in the future.
We wouldn't need to get them really from our employers.
So we're moving from a three-legged.
Some of the European countries have begun implementing, in addition to their national retirement system, they set up a private retirement system that if you have enough discretionary income, you can have that as a supplement. But the main retirement program is the national retirement system. That's what everyone pays into. That's what right now American workers are kind of split into two classes of workers, those with pensions and those without. And how many people who have a pension at a job right now that they don't like, or they'd like to change their careers, they say, I'd love to change jobs, but I can't afford it. If I leave this job, I won't have a pension anymore.
Right.
And so by doing it this way, you make the pension system more what's called portable. No matter where you work, you're paying into your own retirement fund at a much more robust clip that's going to give you a better retirement when you are ready to retire.
So what's the third?
I just want to point out that not only these days, those pensions, those private pensions, or even the public pensions, they're not a guarantee.
Right.
You can pay into those pensions, and then it's possible that you lose them.
That's right. And so it's a very fragile system.
Yeah, we didn't talk about that. I sort of skipped over that point.
Yeah.
That is in my article about how a lot of the government pensions, state pensions, are not well funded. They have obligations that are far greater than what their local or state governments' budgets are.
Right.
So that's another issue as well.
And private corporation CEOs are legally allowed to use loopholes to raid the pensions to pay themselves bonuses and salaries and things like that.
And the federal guarantee of those pensions is getting very weak. So
So anyway, let's go to the third.
You're three-quarters of the way to paying for it. How do you make up the rest?
So the rest, we start looking at other deductions for things like private retirement savings, health care, education, and home ownership. Now, these are a little bit more controversial because basically what I suggest here is wiping out, for example, the home ownership mortgage deduction. And here's why. I mean, it's sort of an interesting point because it shows how, in many ways, we've all been propagandized, I guess, would be the not kind word, but just, I guess, we've bought into the ideology of how you save and home ownership as your retirement, sort of these things. And so the idea of getting rid of the home mortgage deduction is sacrosanct, and getting rid of it is breaking that vow, supposedly. But the fact is, if you look at the numbers, nearly 75% of the benefit from the home mortgage interest deduction, when you measure it in terms of total dollars that people are getting, goes to those who have annual incomes over $100,000. And the fact is, in order to take advantage of these sorts of deductions, you have to have enough income in order to deduct. And yet, if you really look at it, less than 30% of all filers itemize their taxes, and more than 80% of the benefits from itemized deductions go to individuals in the highest income brackets. So, in actual fact, most Americans are not benefiting from these sorts of deductions that we have for home mortgage, for home owning, home ownership, for education, health care, and even private retirement savings, IRAs, and what have you. And so, if we're going to create a more robust national retirement system, then we could get rid of all these other vehicles that we've created for savings, and that's really what these are at the end of the day, because we're going to replace them with this other method that's going to be more robust. It's going to be a portable system, as I said before, that's portable no matter where you are, what job you're working at. You're helping to save more for your retirement, and it's going to be in many ways simpler, because you're simply having to, put more money into your own retirement pension that's through the government, rather than having to figure out, I have this IRA fund over here and this 401k with my employer and all these other things that makes the retirement program just incredibly complex and hard for many people to negotiate.
That would be definitely a challenging one to convince the public of, because I'm sure there'll be all sorts of big lobbies for development and housing that will want to keep that deduction. And it's going to be that'll be a challenging one. So I think, but and so far you've only looked at these are
pretty conservative.
Multiple ways to skin the cat, and there are many others that I haven't even talked about here. Like you can talk about Robin Hood taxes, all sorts of things you can talk about.
Right.
To find other sources of money.
Public investment in infrastructure and taking.
So what is the impact? What is the impact of this change on both the elderly and on the larger economy? Well,
I mean, the interesting thing is that giving more Americans a more robust retirement system, it would be good for the broader macroeconomy, because when you have so much of the savings and tilted into the pockets of the wealthy, they don't really spend that money, and that money doesn't get spent in your broader macroeconomy. But if you have more people with more money in their pockets, they do spend that money, and particularly when you're in an economic downturn. What happens is you see a drop in consumer demand, and businesses have fewer customers. They start laying people off, and you get into a downward cycle.
Right.
By having a more robust retirement system like this, it would act as an automatic stabilizer for the economy. So this is not, just simply about helping out poor people or elderly people, which, should be nothing wrong with that. But in the American conversation, oftentimes that's seen as, quote, welfare. This really, from an economic standpoint, makes sense. it really would make our economy more stable, and it would make it a better system for our retiring seniors. So
well, if you put
in many ways, it just makes sense to go.
You put $1,000 a month into the pockets of 55 million Americans. The vast majority of those, don't have other sources of income.
Buy groceries,
and they have high credit card debt. They need to spend money.
Yeah.
It'd be very interesting to see what the multiplier effect of this kind of policy would be, because I think it would be a dramatic one. And
but I like the point about stabilizing the economy. So, Stephen, thank you so much. I think this is an idea that really isn't being talked about enough, and I hope that we can continue to push this idea out there.
We'll write an article about this in our second part of the show.
And I hope that our listeners will talk about this
Out.
too. Don't cut Social Security. Double it.
That's right.
So thanks for joining us. Tell us where our listeners can follow you.
Well, at my website, StephenHill.com. That's Stephen with a V, -Hill.com.
Okay.
That's where my latest writings and such are usually posted.
Very good.
Well, thank you for joining us, and thank you for the work that you do.
It's been my great pleasure. You have a great day there.
Thanks a lot.
So we're going to go into our last segment, and we have a song called Medicare for All, one of my favorites.
I guess that's the next topic.
That is.
Yes,
You're listening to Clearing the Fog, Speaking Truth to Expose the Forces of Greed, and that was Bob Wickline singing one of my favorite songs, Medicare for All. And we're now joined by Dr. Andy Coates, who is a private physician, in upstate New York. Andy's one of the co-founders of Single Payer New York and is the current president of Physicians for National Health Program. He was recently featured in an article in the Buffalo News called Doctor Sees Shift to Single Payer Healthcare. Good morning, Andy.
Morning, Margaret. How are you?
We're doing great. We're so glad you could join us.
Thank you for joining. We've been talking about Social Security and turning that argument on its head.
Right.
And talking about expanding benefits. Now we're going to talk about Medicare, which is also under attack.
Right.
And we want to put out the point that turn that on its head as well.
Exactly.
We need improving and expanding Medicare, not cutting it.
Which we talked about in our first segment before we brought our guest on. The fact that that Medicare costs are rising more slowly than the private care costs, and that it does better at not only controlling health care costs, but that it is suffering as a victim of the fact that we don't have a healthcare system. And I was wondering, Andy, if you could start us off. In this article, you talk about a person who left the hospital early despite having a serious problem. Can you talk about the concept of self-rationing that exists in the United States right now?
Well, we have an incursion, first of all, of high-deductible private health insurance plans right now. People will pay $1,000, $2,000, even $5,000 out of pocket before their insurance kicks in. And if you think about the median income being in the $40,000 per year range for the average person, average household, and if you think about the poor households, like here in New York State, the middle of the bottom half is somewhere around $14,000 per household. It's a shockingly low number. And we have, of course, upstate New York cities who are acutely aware of, like Buffalo and Schenectady, where we have huge numbers of children living in poverty.
Mm-hmm.
So when you think about the out-of-pocket costs for health care going up and up and up, all the time now, we discharge people from the hospital. We have to think about exactly how much the prescription is going to cost, because it would easily be more than a week's wages, for example, just for an antibiotic prescription.
Right.
And we have chronically ill people who we know are on, 6-8 medications. And so all those out-of-pocket costs cause people to discourage care. And there are studies to prove it. The randomized control trial that's famous was the RAND study of copays. People avoid necessary care when they have to make out-of-pocket costs. But there are oodles of other studies that show that access without copays or deductibles or co-insurance, all those things are impediments to care. I thought you guys would get a kick out of this project that I did last night as a whim. I was thinking about today's show.
Great.
I looked at Franklin Roosevelt's second inaugural, and I just wanted to share with you these 5 lines or so. Here is the challenge to our democracy. In this nation, I see tens of millions of its citizens, a substantial part of its whole population, who are at this very moment denied the greater part of what the very lowest standards of today call the necessities of life. I see millions of families trying to live on income so meager that the pall of family disaster hangs over them day by day. I see millions whose daily lives in the city and on farm continue under conditions labeled indecent by a so-called polite society half a century ago. I see millions denied education, recreation, and the opportunity to better their lot and the lot of their children. And he says, I see 1/3 of a nation ill-housed, ill-clad, ill-nourished. And the difference, this is in 1937. You think about the pressures that came to bear on that White House and this frank recognition of poverty. It's a striking contrast to today.
We still have all those same problems.
Right, and so that was 1937. That was, and we're going to we've written about this in our upcoming Truth Out article, is that prior to that, he was pushing cuts. He was pushing austerity measures.
The first segment of the New Deal, they grew rapidly. Unemployment dropped at the fastest rate it's dropped in our history. In the first segment, 1936, the deficit cutters, and Roosevelt was one of them, got the decision that we need to cut these, that we're going too fast, and they cut the New Deal programs, resulted in a recession.
Right.
So 1937, he's in the midst of a recession. He's doing what he's saying what you're reading, which is 1/3 of the country is ill-clad and ill-fed.
Yeah.
And that's still true today. Now we're talking about austerity. We should be talking
about prosperity.
And the self-rationing is part of it that you talked about, Andy. Talk a little bit about medical bankruptcy as well. Those who end up getting into a serious health problem and have to spend have to get care. What happens to them?
Right. So in the United States, the leading cause of bankruptcy are medical debts, and of those who are bankrupted by medical debts in our society, the big majority have health insurance of some type. when the illness comes that ends up bankrupting them.
That's right.
So health insurance does not protect, the way that health insurance works, it does not protect us from devastating costs. We also have, it continues, and at the end of life, patients just commonly have bankrupting illnesses that end in long-term care on Medicaid.
Mm-hmm.
People lose their jobs taking care of loved ones because of the self-sacrifice of bodily care, of getting to appointments. The jobs that working people have don't have lots of time off or sick leave. The Family Medical Leave Act gets you a pass from the boss. You get to keep your job, perhaps, but you don't have a paycheck.
Right.
So then people lose their homes because their parents are sick. It's very, very devastating. And these are private tragedies in our country. Although everyone talks about it, and we all have a story, I say at this point, everyone has a family member or an acquaintance who they know rather well who has had one of these devastating consequences.
That's exactly right.
Even though that happens, it remains somehow a private tragedy, and often some people even look at it as a shameful, some kind of personal failing, and it shouldn't. It should be it's the social responsibility. These kinds of devastating illnesses, because it could happen to any one of us, and so we should add. It's all in each of our interests to advocate that we would all get the best chance at care.
Right. So let's talk about that a little bit, because the dominant conversation out there right now is what we have to cut Medicare, but that's really
or worse, privatize it.
Yeah, and raise the age, and it's horrendous what the Business Roundtable is promoting, and others as well. So can you talk about what's not being talked about enough about Medicare for All, about the fact that we actually have a solution that would bring us out of these crises, the healthcare crisis and the economic crisis?
It's definitely an irony that, that in the United States there are models of care or paying for care that have actually worked rather well. Medicare is going to be coming up on its 50th anniversary. It's perhaps the most popular program of all time for the country. And that said, it's not perfect. Medicare is far from adequate. It could definitely be improved and expanded. There are many things that Medicare doesn't pay for. People still face staggering costs. The fact that dental care is left out of, for example. But nevertheless, it works, and it has worked well in terms of cost savings. A big portion of the money goes actually to the care of human beings. Only about 3% goes to administrative expense, compared to over 20% in the private health insurance industry.
Right.
And people have come to completely count on it. Once retired, the fact that Medicare is there as a lifesaver for the elderly, and it's also there for the disabled. So Medicare has worked very well, and to then scream that it's that it's failing and needs to be privatized is quite silly. It's amazing where the discourse is in the mainstream.
It really is.
Yeah.
It's so out of touch with reality.
And the majority of the population already supports having a Medicare for All type of system. It's not an experiment. It's in place all around the world.
The question is then, what is the impact on the deficit if you go to a Medicare for All system? Because that's all about deficit these days in the Washington consensus.
Right.
But when I look at the numbers, it looks to me like healthcare is driving the deficit. So how would Medicare for All affect that?
Well, certainly healthcare spending is gobbling up a huge portion of the entire economy.
Right.
And so what would it mean to the government? Well, if all government spending were redirected toward a public care system, there would arguably be enormous savings of lots and lots of waste in the private sector now.
Right.
That could be redirected toward care. And that would mean real health systems planning, which would in turn mean clinics and hospitals in places that need them.
Wow.
An expansion of infrastructure. There would be that, for example, we always talk about dignified home care for the elderly. And one of the greatest hypocrisies in this society, I think, is that there's so much celebration of the greatest generation, the World War II generation, that's presently in their senescence and many times close to death, and that those patients are not able to get dignified care in their homes because of reasons of cost. So if there were a public Medicare for All system that were expanded, that would be our chance to really show the respect for that generation that they deserve, and to train and deploy through a system of local planning, home care teams that could keep people at home and dignified rather than losing their home or going into a reverse mortgage or all these other horrible choices. So I really think that what would that mean for the economy and the deficit? Well, it would actually besides being a point of political pride, it would be an incredible jobs program, and I think that would go a long way toward any kind of deficit.
No, in fact, our article in Truth Out that will be coming out later this week from last week's show talks about how you want to solve the deficit, solve the jobs problem. But there's no question that economists look at Medicare, and if you said Medicare for all, you solve the deficit problem as well for the long run.
If you brought our healthcare costs in line.
So what both segments of this show is that the conclusion is Medicare is not the problem, it's the solution. Social Security is not the problem, it's the solution.
Right.
And we need
should
to
expand
change the dialogue. Right. And I really appreciate Andy's work with PNHP. People want to stay involved in this issue. PNHP.org is a physicians group that does fantastic work that Andy's president of, and people should go there for real fact-based information, pnhp.org.
Right, or bring one of the PNHP docs to your community to talk to people. Thank you so much for taking time out from your busy day, Andy, to be with us.
Thank you for having us on the call. Thanks.
Great. Okay, so that's our show for today. We're going to go out with our song from Junkyard Empire, We Want. The people organized
can build the kind of system
we want. That's right.
That while the intensity of the financial crisis may appear to be receding, jobs markets are giving completely different signals. ILO Director General Guy Ryder said that the dire job situation shows the crisis is far from over. Speaking during a panel discussion at the World Economic Summit in Davos, Switzerland, Ryder stressed the urgent need to tackle the employment.
It's our economy.us that talked about how it's legal for corporations to steal from these pensions.
If you put it's our economy.us and search Peabody, you can find this article about how they essentially destroyed their employees' pensions in this one firm.
Right, and as we talked about in a previous show about the tar sands blockade going national, there was an excellent protest over the weekend in Portland, Maine. Groups came together to protest the tar sands.
It coincided with the Northeast Regional Gathering of Occupy.
That's right.
And a lot of organizations were involved in this, and they had over 1,000 people out.